are we doing? This is another amazing episode of Dental Student Vibes, the Dental Student Vibes podcast. How are you guys doing? Today, I have Matt Havis with me. I'm Seth Kalish. Matt, how are we doing?
We're doing well. We went through our first round of exams.
Yeah.
Made it through, slightly unscathed. I passed all the exams, so I'm very happy with myself. That was round one. We've got plenty of other rounds to go. So just got to get through this marathon.
It is definitely a marathon.
Yeah, just trying to go to the gym, trying to eat healthy, fighting the good fight.
Yes, sir. I think probably the most difficult exam was, I don't know, was it perio or was it oral surgery? I think oral surgery wasn't terrible because that stuff, like, that's when it really got interesting.
Yeah, that was very interesting because it was things that you want to do, like surgical extractions and stuff. I soaked that up. I didn't even have to read the PowerPoint for that. I just remembered all of it because it was so interesting.
Learning all the instruments, the different cuts. You have your sulcular cut,
the
crestal, envelope cut,
then the vertical
incisions.
Oh yeah, and then you have your releasing incisions afterwards.
Yeah,
very interesting.
I can't wait to do that. That's gonna be wild. Like when we start doing that.
The goal is clinically, you could do your drill and fill, the crowns and the bridges, but then to get to the point where you're doing mainly surgery on people. That's my goal clinically, is where you're a general dentist that can do all scopes of surgery. You know, I just find it so interesting.
Right. And I mean, especially, you know, when we start flapping back, and I can't wait for like the first surgical extraction.
Oh man.
That's going to be
on a molar too?
It might be really hard.
Oh, you know? I'm sure it will. But you know what? I feel like after going through the PowerPoint and having like some faculty by you or whatever, you know, I feel like you'll be pretty well prepared. And plus, I'm sure your first extraction is not going to be a, surgical extraction. So you just do a more simple one to start out. You know, you got to crawl before you walk.
Yeah. But you know what's funny is they say that learning the stuff from the lecture, from the PowerPoints, means nothing until we actually go in there and do it.
That's true. And it's funny because after just seeing it or whatever, like, I could do that. You watch some guy do it and they make it look easy. But God knows as soon as we're going to do that, we're going to pick up the instrument, hand shaking and everything. Right. Can't even get it in the the bone.
It's going to be interesting doing the incisions. But so what else you been up to besides school?
Gym. And we've been doing a lot of we did some shadowing.
Yeah. Yes, we did.
We've been trying to golf. So in Sarasota, there's a nice guy. His name is Dr. Doan, and he is a dental stud.
He is.
He's
absolutely
brilliant.
Yep, I actually got the opportunity to shadow him the other day. He is the past president of the American Academy of Cosmetic Dentistry, and they had a conference recently, and boy, I tell you, that thing, they had some really, really awesome speakers. This one guy, I can't even attempt to say his name, but he's from Ukraine, and Dr. Doan had the praise of the highest words to this dentist, and he really does some beautiful work. He's also like really into photography, and they have some very incredible courses there. But that's something that I want to get into eventually.
Absolutely, like a very, very high quality like cosmetic dentistry type practice where you could implement that and everything, and it's almost like art in your mouth.
Right.
People take it to like a new level.
And that's what Dr. Doan does.
Yeah.
He's really like a very high end dentist.
It's like Picasso with a scalpel.
Exactly. He doesn't do too much surgery.
Well, Picasso with a, I don't know, waxing instrument.
Yeah. I shadowed him yesterday, and beautiful office. Absolutely beautiful office. The design, the architecture of it, just from the outside, you're like, wow, this is something. And then you go inside, very very contemporary. It's got nice art on the walls, and they greet you right when you walk in. I think it's it's a good model of like how I
it's
want.
Like pretty modern.
Yeah, it's modern, and it's how I would want my practice to be.
Very nice.
It's got a good vibe to it.
Did it feel like homey as well though? Like where you feel more at ease, where you're not stressed out as
absolutely.
much? That's
absolutely. Good. And so Dr. Doan actually just does fee for service, and he was telling me that he used to want to go into just prosthodontics. Wow. But now he does these full mouth rehab cases, and he's like, he showed me yesterday. He gets he got this case back. I don't know when the patient's coming in, but he's like, oh yeah, there's a several tens of $1,000 case. Actually, the case was like 30 grand, and I'm just like, oh wow, you know.
But the cool thing is, like, he gets this stuff, but he's just so cool about it too. Very low key. It's like, and he you could tell, like, he looks more towards helping the patient and then getting them to their end result of how they want to look and feel versus the payday he's receiving.
Right, and you can tell the thing. Okay, so one of the things that I really took away from shadowing him yesterday was he really wants the absolute best for the patient. Mm-hmm. And so, you know, he uses like the best materials as well, and he is very, very skilled clinically. And so he's telling me, he's like, you know, the most important thing is when the patient says like, okay, you know, maybe down the street's going to be a little bit cheaper than here, and Dr. Doan's response is, well, that's fine. Go ahead and go to them, because here, know that I'm giving the absolute best care. I'm providing, you know, the best clinical experience that I can offer, and the patient is going to be cared for at the highest level. You know, it's not just going to be run-of-the-mill type of thing. So I can really like appreciate that. You know what I mean?
That's nice that he's a real patient advocate. You know, you don't find that a lot. I mean, there's good guys out there and everything, good practitioners, but they're so few and far between where you get somebody that really just truly cares about the actual patient and what they want and what they need.
And I got to see him do a couple procedures. It was actually kind of cool, because it wasn't like a everyday cases that he had yesterday. So two of the most random things got to see yesterday. A patient had hand, foot, and mouth syndrome. So that was, I mean, I've never seen that before with a patient. Yeah, it was clearing up, but and then another really, really interesting case was a patient had I think it was medically induced osteonecrosis of the jaw.
Oh my gosh.
And it was of the maxilla, and the patient was basically had a few implants, and the bone was just disappearing.
Oh my gosh.
And you could see, like in one of the pictures, you could see the apex of the teeth. Like it looked like the teeth were just hanging on by the apex, all the molars. So it was crazy. And so what they did, it was with him and an oral surgeon, they were kind of just trying to figure out, okay, what are we going to do for this patient? Do we want to put, because it was right up next to the sinus. That was one of the problems. And so at this point in the treatment, they had kind of like this metal superstructure that would go from the anterior back to one of the implants in the posterior on the maxilla. And so it was an incredible case. You know, it really would take some thinking, contemplating how to approach the treatment.
Was the patient on bisphosphonates?
That's the first question I asked him.
Really?
Yeah, that's funny. So, yeah, a couple other things about his office I really liked. You know, well, first of all, he has a beautiful office. I already said that, but he's got a lot of new technology. Do you remember one of our professors was showing us all the digital dentistry things? So Dr. Doan's got the Prime Scan, like that new one that just came out. And we didn't get to use it, but like he was telling me.
Is that the CEREC?
Yeah, it's like basically.
Okay.
And wow. CAD cam, yeah. So one of those machines, and that was very.
Did he show you like the ins and outs of it and everything, or
no? We just talked about that, and then like he was showing me like now the cases he gets back from the labs, they're all like on 3D printed models. They don't. I mean, one of them was stone, but like it's interesting like how it's really moving forwards. But also Dr. Doan, he's in the Sarasota. He was in the Sarasota 40 under 40, which is so cool. That's a pretty cool.
That's a unique accomplishment too, to be able to say to somebody.
Yeah. Oh, one of the other really, really neat things about his office, he has one operatory that's completely dedicated to photography. So like you open the door, because there's like the door is closed, you open the door, and full photography equipment everywhere.
Like a full studio.
And like he's got some really beautiful.
Like he's got like the best lighting and all
Yeah,
that, the
yeah.
DSLR cameras and all that.
Yeah, because he does some beautiful photography there.
Wow.
So, but some neat stuff, and the
That's
guy
really
the
cool.
guy knows a lot about business. We were talking. One of the things I think was interesting, he was saying, because I was asking him like, okay, tell me about like you bringing on associates and all that sort of thing, right? And like, you know, you're gonna open up another office, that sort of thing. And he was saying that one of the problems that like some associates have when they first get out of school, some new dentists have, is they don't yet have like a reputation, and so they might have difficulty getting the new patients. Like, let's say if you buy a practice initially, or like you do a de novo startup, you're not yet well known, and so he was saying if he took on these new associates, he might not have the patients that are going to go to see those associates specifically. So he was saying if he went to open another office somewhere, and like possibly Lakewood Ranch or something, he was saying that he would have to work in that office for a little bit and then place the associate there, so that like the patients would start coming in, because he's got like a reputable name and he's got his brand, you know.
It's interesting. I've never thought of that before. I've
Yeah.
really heard of that. That somebody would choose a different office based off of the person, like versus the young dentist, you know.
Yeah, I mean, because think about it.
When he would have to transfer.
Yeah, well, when you go into an office, that's one of the problems with putting your name on so this is something I learned recently. That's one of the problems putting your name on the practice, is if you do that, maybe a patient's going to come in and they're going to say, "Hi, I'd like to see Dr. Matt," and you have associates, and the patient's like insists, "No, I want to see Dr. Matt. This is Dr. Matt Dentistry." So if you change it to just like pick a Big Smiles Dentistry, the patient isn't going to come in there looking just for you. So therefore, you can pass the new patients off to your associates.
You know, and that makes a lot of sense too.
Right.
Because like, I mean, when I would take my grandfather to the doctor or whatever, he'd be seen by some random, you know, like cardiologist or whatever, but it's not like the head honcho, and he'd be upset by that immediately. Granted, he's old and stuff, so he doesn't quite get it. But because he wasn't seen by the top like person, he would immediately be, you know, he'd lose respect for that office.
Right. So, anyways, we have another big announcement for all of our listeners. For those of you that are applying to dental school, we're trying to do everything we can. We're trying to figure out how can we help you out. How can we help you ease your process of getting into dental school? How can we help out with the interviews, all of that sort of thing? So we're actually going to be releasing an ebook soon, very soon. So if you're interested, it's going to talk about what to do after you've submitted your application and during your waiting period. That's like the most scary period of when you're waiting for an interview or you're waiting for your acceptance. So we're releasing an ebook on that. Hit us up on Instagram at dental.student.vibes. Message us. Let us know, if you want the book, just ask. All you got to do is ask. We're also going to be publishing it on Amazon as well. So you can take a look at that. We'll be publishing the title. Still got to think of the title. But
download it. It's free. It's 10 pages, quick read. You can do it on the toilet easily.
That's right. So let us know what you guys think. Also, if you guys have any suggestions on somebody you want us to interview. Oh, by the way, speaking of interviews, we got a big interview coming up soon with Dr. Paul Etchinson of the Dental Practice Heroes podcast. Real cool guy. I'm excited to talk to him. You excited to talk to him, man?
Oh, absolutely. So we're going to learn a lot from him. Hopefully you guys learn plenty just like we will. And, just keep pushing forward. Do better every single day.
That's right. So if you guys have any questions, if you want to hear about Dr. Etchison, if you want to download the ebook, if you want to get into dental school, if you want to graduate dental school. I want to graduate dental school already, jeez. Hit us up on Instagram at dental.student.vibes. Hit us up on Facebook, on Twitter at DSV Podcast. And be sure to click subscribe and share the podcast, if you love it, with one of your friends. So thanks for listening, guys. As always, can't do it without you. And we look forward to speaking soon.